This is Dr. Vaishali, and I'm reading from the book Substance of Homeopathy, book written by Dr. Rajan Sankaran. Chapter number 25, Illustrative Cases. Case number 5. Mr. VP, 40 years, came with her husband and uncle. Mrs. VP, 40 years, came with her husband and uncle with a complaint of recurrent fever. She has been diagnosed as a case of patent ductus arteriosus. The echocardiogram suggests revealed the vegetations, and the patient had been informed that she had subacute bacterial endocarditis. Has had a fever since 7 years. During the fever, she had a stiffness of the finger in the morning on waking. She was rather shy, had restlessness of the hands, was wearing firing on her finger, and also black thread around the wrist. The ring had different stone in accordance with the astrological belief. She was always very anxious about her son. He was in America when rioting took place there. She craves milk, especially warm milk, sweat much on the left half of the body. Now, analysis of this case. The main feeling in the case is that of a threat which could prove dangerous, even fatal, unless a lot of effort is put in to save the situation. On one side, there is a hope and the effort, while on the other side is a danger with the fear. This can be seen in the situation of the rioting, feeling of acute threat causing a fear, panic, and restlessness in her. Next, we consider the numerous ring worn according to the astrological belief. This shows an intense effort to save herself from the possible disaster. The main pathology itself has a fever which is not very high or threatening, but there is a possibility of it become a dangerous. At other time, it is quite normal. The focus of this case lies between the acute feeling and the psoric feeling. There is an intense struggle to overcome the problem. This is the subacute or typhoid miasm. Even the pathology has been termed subacute bacterial endocarditis. The remedy we shall choose must lie mainly in the subacute miasm. It must have the feeling that some mishap is likely to occur without knowing exactly what to anticipate, and the need to put in lot of effort to save oneself from that. In this case, the feeling when converted into the repertoire rubric, and rubrics are fear happen something will, fear superstitious, anxiety about the children, sleepiness before the heat. We get the rust toxicodendron is a well-known typhoid remedy. It is the only drug given under the sleepless before heat, which is mentioned in the Kunzli Can's repertoire general, and the patients improve very well not only in the fever but also the state of mind. When she came the next time, after the 3 months, she was wearing just 2 rings, thus also indicating to me that the remedy has had a desired effect. Now, case number 6. Mr. GM, 34-year-old, came with a hypertension, headache, ischemic heart disease, and insomnia. Childhood stage felt he was not being attended to. Lots of financial crisis. And my personality growth was very, very ordinary till I left my family to study. Then I achieved my personality. He had a frequent attack of migraine, so severe that he had to take a leave from the office. Very big family of 25 people. We were millionaires in Burma, but when we left, we had nothing to bring back with us. The weight of all this was on my father. My mother used to have a hysterical attack, and in the childhood, this tension always remained with me, always getting into the problem. Always mismatch. When we came to Bombay, father had severe problem because of the huge family. I was neglected. My mother could not express her anger at anyone else, and so all her frustration was poured on me. I had to work a lot as we were financially not in a good position. After I joined a business, my brother and I didn't get along well. Due to his many weakness, he became a burden to me and the business. I was only the one handling the big business. I had to close down in the 1977 due to the losses. At this time, I developed a high blood pressure, and my father expired around the same time. Except for the blood pressure, my life was really peaceful. He is very critical about family member, finding fault with everyone except his wife. And his divorce of a love marriage, and his wife and mother don't get along well, and this is his greatest worry. As far as personality is concerned, I am very sensitive, but I don't speak out. He has inclination to read spiritual books, meditate, etc. My college days personality point of view, I can say, were very good, but academically okay. In the business, I keep a low profile. I am cautious not to overdo it. And dreams were accident, train, self, mother, or somebody of her age dying, and sexual or amorous, calamity like a thunderstorm, war as if our building was bombarded, and dream of a monkey on a tree. I like monkey very much. I like their eyes, twinkling, deep stare, jumping, funny, anger, hair on the head, etc. I like to be alone, at peace with the nature. I like company of people of the similar nature. Broad outlook on life, spiritual talking, reading, activities, etc. I like activity where I get importance. Now, analysis of this case is what we see that this man had many problems since his childhood. The financial problem, not getting enough attention from his parents, being criticized by his mother, the problem with his brother, etc. The feeling here is that life is struggle. However, there is a hope, and we don't find the patient having any negative feeling about himself, nor is there any despair and resignation, means no any hopelessness. This is the soric personality. To differentiate between the remedies of the miasm, we have the fact that he feels criticized, suppressed, and not having received due importance. We also see his attempt to become a knowledgeable, gain importance, and get recognition. We would select the following rubric: element from scone, delusion disgraced C is religion, speculation dwell on censorious, and the remedy was sulfur, and it is helped him beautifully. Not only did the hypertension and ischemic heart disease improve, the patient felt more contented than even in his life. His internal agitations reduced substantially.